audible tones produced by left ventricular assist devices may be altered in the setting of pump thrombosis and provide an early warning signal for that complication. My name is Barry Boylston. I'm a cardiologist at Mayo Clinic in Rochester, Minnesota, and I'm going to discuss the paper Acoustic Properties of Axial and Centrifugal Flow Left Ventricular Assist Devices and Prediction of Pump Thrombosis, which is going to be published in a future edition of Mayo Clinic Proceedings. Left ventricular assist devices have transformed the care of patients with advanced heart failure, both providing an alternative to cardiac transplantation, as well as providing a means of providing stability until transplant for those who are transplant eligible. As an LVAD is a foreign body through which blood has to circulate, there's an inherent risk of thrombosis developing, which can have devastating complications, including the risk of pump stoppage and embolic complications, including stroke. Unfortunately, this is often how patients who develop pump thrombosis actually present, and for some, this can be too late. In some patients, we do get some warning of incipient clot developing when we begin to see some surges in power usage or evidence of intravascular hemolysis, but often the clot is already well established at that point, and the measures taken with more aggressive anticoagulation, etc., only really help to prevent progression, but not to reverse the situation, and patients often still have to progress to another operation for pump exchange. So as such, an earlier warning system would be very advantageous. So during my cardiology fellowship and encountering VAD patients for the first time, I was struck by the musical tones that are audible when I examined these patients and listened to their chests. And it struck me in particular that there appeared to be at least 2 or 3 notes, if you like, audible. And essentially, I had a desire to try to characterize these tones in different devices and perhaps see if useful clinical information could be derived from them. And as I met patients then coming in with various manifestations of pump thrombosis, I was struck by some subjective differences in the tones that I and some of my colleagues could hear, and sometimes even patients themselves. So, and it's actually on the first figure in the paper, it describes that a little bit, where you can reliably pick out 3 tones. And you can see that actually in all 3 devices. But with the HeartMate 3, you're seeing it probably has the most kind of balanced representation of all the harmonics. The HeartMate 3 also has the 7th harmonics. That's very interesting. That's probably where the area of interest is actually in these higher order harmonics, because specifically what we're seeing is that the relative amplitude of that 3rd harmonic, if you like, that high G, is amplified compared to the fundamental middle C in the setting of thrombosis in the HeartMate 2. So that was the birth of the project, and it was really something that I undertook as a crusade of curiosity. So when we actually went back and looked at the data, the recordings that accumulated with our engineering colleagues, we could see that there were predictable harmonics detectable in all 3 devices we studied, the HeartMate 2, the HeartWare, and the HeartMate 3. And where thrombosis was suspected and ultimately confirmed in patients with the HeartMate 2 device, there was an increase in the relative loudness or amplitude of higher order harmonics. In other words, the higher pitched sound components, the 3rd harmonic in particular. Because the axial flow HeartMate 2 device has been around longer, and we've had over 10 years experience with it already, we saw more thrombotic events with this device type over the 4-year period, and these findings were confirmed in that device type only. Although we've been able to describe the normal tones present in the HeartWare and HeartMate 3 device as well, because we haven't had the same cumulative experience as yet with those devices, we haven't seen enough thrombotic events as yet to draw any conclusions as to how acoustics may be altered in the setting of pump thrombosis in those particular devices. So in terms of how this finding relates to clinical practice, this work is ongoing, and we're now focusing our attention on the current centrifugal flow devices, the HeartWare and HeartMate 3, and using even more refined equipment to examine those higher order harmonics, which are probably of great interest. And we hope that we may be able to uncover acoustic signatures of thrombosis in those devices as well, which may ultimately refine our ability to diagnose LVAD thrombosis early. In terms of what this means for patients, making a very early diagnosis of pump thrombosis could save patients from devastating complications down the line, from the risk of thrombotic complications, from the risk of pump malfunction and stoppage, and if they were to survive those, the risks associated with another operation to exchange the pump. This could potentially make an enormous difference to the care we provide to these patients with these life-saving devices.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.